Hi everyone, Dr. Owen MacDonald here from Core Medical and Port Kennedy Respiratory Clinic. It's Friday the 19th of March and I just want to give you an update on COVID vaccination. So we will be commencing vaccination with the AstraZeneca vaccine next Tuesday the 23rd of March. This will be out of the Port Kennedy Respiratory Clinic next door to Core Medical, so not in Core Medical itself. The booking platform is now live on HotDoc, or if you go through the Health Direct COVID vaccination eligibility checker, you will get the links to it that way if you put in your postcode. It is eligible for people in Phase 1A and Phase 1B. So the Phase 1A people are quarantine and border workers, frontline healthcare workers, so that's anyone who works in GPs, pharmacies, dentists, physiotherapists, any allied health. You are eligible. Aged care and disability residents and aged care and disability staff, so any carers of any elderly people or carers of people with disabilities, you are eligible. The other people who are eligible is anybody over the age of 70, any healthcare workers, as I said, any Aboriginal and Torres Strait Islanders over the age of 55, younger people with an underlying medical condition. Now they are specific. It does exclude some people like mild to moderate asthma, but if you have the likes of diabetes, chronic lung disease, chronic heart disease, any of those things, you are eligible. And if you go on to the eligibility checker on the government website, it will tell you if you're eligible or not. And the other people who are eligible is critical and high risk workers. So I would encourage people who are coming for vaccination, please only come if you really want the vaccine. If you are still unsure about it or have questions about it, please make an appointment with your regular GP to discuss it or do some more research yourself. The way the vaccine clinic is working, we have been engaged by the government to do high volume mass vaccination, so there will be short appointments. You'll be coming in, have a quick questionnaire, we will consent you, a temperature check to make sure you're well on the day, and then it will be a vaccination, and you'll wait a period of 15 minutes afterwards, or 30 minutes if you have a history of anaphylaxis, and then you will go home. Unfortunately, with the volume of people we have to get through, there will not be the opportunity to have long conversations about the pros and cons of vaccine. You need to be absolutely sure you want the vaccine. So please, if you are unsure or have questions or sitting on the fence about it, please don't book in for it. Have a chat with your regular GP about it, and only come along if you are absolutely sure you want it. The other thing is, be prepared on the day. Wear some nice loose fitting clothes. Wear a short sleeve t-shirt so you can pull your sleeve up so we can vaccinate you easily, and be prepared to wait around for about 15 minutes afterwards. Please don't come too early, and obviously please don't be late. As I said, it's going to be high volume, so we don't want too much overcrowding in the waiting room, and you will have to adhere to obviously social distancing. Obviously there may be some teething problems along the way. It's a very new system for all of us, and you've seen the frustrations on the news with both GPs and patients, but over the next week or two we'll get into the swing of things. And also please be patient. We have been given hundreds of vaccines per week, so please don't rush, don't try and bombard us with phone calls. We have lots of vaccinations to go around, so please be patient with us, and book in, as I said, online if you can. Our telephone system is really busy, so if you can at all, book in online using the booking system. That will bring you to the Australian government registration form, and that will populate all your information into our system. If you are elderly or not so tech savvy, or if you know someone who is not so tech savvy, please help them out, help them to book online, because it will make the system on our end, and it'll make your whole experience much smoother if it is all registered and our system is populated with your information when you arrive. If we have to register you on the day and get you to sign forms, it'll slow the whole process down, and it'll be much more frustrating for all of us. So I encourage you all, if you can, please book online through the booking portal. It'll go through HotDoc, as I said, and then it'll bring you to the Australian government website where you will register with your Medicare details and consent, etc. So if you have any questions at all, please pop them in the comments below. I can do another video over the weekend with some answers to those questions. There probably will be more questions to hopefully clear things up a bit, and hopefully see you soon for COVID vaccines. Take care.